Hello, my name is John Moyer, and I want to welcome you to the NIH Office of Disease Prevention's Mind the Gap webinar series. This series explores research design, measurement, intervention, data analysis, and other methods of interest to prevention science. Our goal is to engage the prevention research community in thought-provoking discussions to promote the use of the best available methods and to support the development of better methods. Before we begin, I have some housekeeping items. You can submit questions during the webinar via the chat pod. You'll need to open the pod by hovering your cursor at the bottom of the Zoom window and then clicking on the chat icon. Please direct your questions to hosts and panelists. We will open the floor to questions that have been submitted via the Zoom chat pod at the conclusion of today's talk. The slides and video recording will be posted on our website, prevention.nih.gov/mindthegap, in approximately 2 weeks. Lastly, we would appreciate your feedback about today's webinar. Upon closing, you will be asked to complete an evaluation. We would appreciate your feedback as it will help us improve this webinar series. At this time, I'd like to introduce Dr. David M. Murray, Associate Director for Prevention and Director of the Office of Disease Prevention.
Thank you, Dr. Moyer. Today's speaker is Dr. Lonnie Phillip Tabb. Dr. Phillip Tabb is an Associate Professor of Biostatistics in the Department of Epidemiology and Biostatistics. She is also Associate Dean for Faculty Affairs, both at Drexel University's Dornslife School of Public Health. She has been a principal investigator and co-investigator on several projects funded by the National Institutes of Health, the National Science Foundation, the Robert Wood Johnson Foundation, the Annie Casey Foundation, and the Sidney Kimmel Cancer Center. Dr. Phillip Tabb's research aims to develop and utilize novel and existing spatial and spatiotemporal statistical methods in applications to address and eliminate racial inequities in the health of populations across the US. Her contributions provide the evidence needed to inform policymakers, health officials, and the communities affected by racial inequities to create sustainable change and solutions for these public health challenges. It's my pleasure to welcome Dr. Phillip Tabb.
Thank you so much, Dr. Murray. And thank you all for attending today's webinar. I'm really happy to be present at this webinar series, which really has been a staple at NIH in the Office of Disease Prevention for some time now. So I'm really humbled to be an invited speaker with you all today. And so the title of my talk today is Exploratory and Inferential Spatial Statistical Methods, Tools to Understand the Geography of Health Across the United States. Now, before beginning, I would like to offer a land acknowledgement. Drexel University, which is where I currently sit, is in Philadelphia, Pennsylvania, and it physically exists on the ancestral lands of the Lenni Lenape people. And I'd like to acknowledge that the Lenape people are the original inhabitants of not only Pennsylvania, eastern parts of Pennsylvania, but Delaware, New Jersey, as well as Southern New York. And I'd like to offer my respect and gratitude to the Indigenous peoples past, present, and also future, whose custodial responsibility we honestly all benefit from. And then also to acknowledge that the land stolen from these nations, whether through colonization, broken treaties, or even forced removal, and their inherent right to self-determination. So a little bit of a brief roadmap to basically outline where this webinar will take us. First, I'll start off with a little bit of a history lesson that dates back to the late 1800s to now motivating factors that are grounded in what we all know now to be Healthy People 2030. And then to basically drive the usage and motivate the usage of exploratory and inference-based spatial data analysis methods. And I'll aim to basically highlight a few of the methods, not all, and some empirical examples, and then close with some thoughts that I have in terms of what next. Now, please, I'd like for folks to kind of keep in mind that we only have a brief amount of time, and this is information that honestly could be captured in at least 1 or 2 semesters with respect to understanding the statistical inference as well as the applications as it applies to spatial and spatial temporal statistical methods. So as promised, I always like to start off with a little bit of a history lesson, if you will, So this image that you see of this man in the middle, this is W.E.B. Du Bois. Du Bois was an African-American author, sociologist, a civil rights leader. And the image that you see up on the left is the cover of The Philadelphia Negro, which was a landmark study that Du Bois conducted in terms of sociological field research in the city of Philadelphia. So right where I'm sitting right now. And this was in Philadelphia's African-American neighborhoods. And what Du Bois did was he went into every single Black residence, their churches, their businesses, and also recorded things with respect to their occupational structure, and as well as their family structure. So somewhat of akin to a census, but for African-Americans in these particular neighborhoods. This work was conducted in the late 1800s. And the thing that's really important to understand with respect to this work that Du Bois led up is that he identified that Blacks at the time were afflicted with many different health and social problems. And there was a what next component that he harped on that basically involved Blacks and whites at the time being equally part of the solution at trying to change the perception of Blacks from inferior to equal, and how that then would lead to addressing many of the different problems that the Black community faced at that time. And unfortunately, there are a number of Black communities across this country where this is still unfortunately the case. So I always like to start off with this acknowledgement to Du Bois because it really does drive a significant portion of the research and the training that I've been involved with my entire career as a biostatistician. So if we transition though from the late 1800s during Du Bois's time to now say the late 1900s, we can really start to think about the importance of overall health and well-being, but capturing that within the Healthy People framework. So there was a landmark report that was issued by the Surgeon General back in the late 1900s. And this was the birth of the Healthy People 1990. And this came out of the Office of Disease Prevention and Health Promotion. And it was measurable 10-year objectives for basically improving health and well-being nationwide. There was a focus at the time on decreasing deaths throughout the lifespan and also increasing this independence, if you will, when we focus on aging populations. And then every 10 years, we can depend on Healthy People coming out with these measurable 10-year objectives. So we had 2000, 2010, we just came off of 2020, and now we are looking towards Healthy People 2030. And so the nice thing about Healthy People 2030 is that it builds on this knowledge that's been gained over the past 4 decades. And there has now been this increased focus on 4 things that I'd like to highlight: health equity, health literacy, a new and improved focus on well-being, and this last one, social determinants of health. And the reason why I lead with focusing on one of these 4, in that the social determinants of health, is because it really does get at this conditioning in terms of how we look at our environments and where people live, learn, born, work, play. All of these environments are impacting a wide range of health and functioning and also quality of life, whether you're on the outcome side or whether you're on the risk side. And within the social determinants of health framework, there are 5 or so specific domains. There's economic stability, there's education with respect to both access and quality, similarly for healthcare, and then there's neighborhood and the built environment and the social and community context. And one of the goals within the Healthy People 2030 framework is to really create social and physical and also economic environments that promote attaining the full potential for health and well-being for all, not just a select few, but for all. But how do we do this, right? Like when we think about the social determinants of health and how we're really honing in on this one particular domain of neighborhood and built environment, that looming question of how. How do we define a neighborhood? How do we explore the resources and attributes in a neighborhood? And then also, how are we tying what we're calling a neighborhood to different health outcomes and also exposures that we're really interested in ultimately measuring? And when I pose these questions, these are not trivial questions, they're pretty big. And I'd like to first recognize that when we're talking about a neighborhood and we're defining a neighborhood, this can be subjective and it can be objective. So for instance, I live in Newcastle County, Delaware, the first state, but I also work in the city of Philadelphia in Pennsylvania, where Drexel University sits. My neighborhoods, like many of us, really do vary based on where we're living at the time, where we're learning, where we're worshiping, where we're working and playing. And so for this webinar, we are really going to focus on discussing the different methods that allow for mostly an objective definition of what a neighborhood is based on, say, administrative boundaries, things like census tracts, things like counties, states, but also appreciating that many people, myself included, makes decisions on how to live, learn, work, play, worship, whatever it is, based on subjective, qualitative understandings of what defines an actual neighborhood. So let's first start off and talk a bit about some, not all, this is not an exhaustive list, but a few exploratory spatial data analysis methods that can then capture what's going on at the neighborhood level. So with exploratory spatial data analysis methods, this is really an extension of exploratory data analysis. It's just now that you have a focus on geographical data. And I pull in Tobler's first law, which really speaks to everything is related to everything else, right? Technically, but nearer things, closer things are more likely to be related than things further away. And when we're saying further away or nearer, we're talking about geography here. So when we're thinking about these exploratory spatial data analysis methods, we have to keep that law in mind. And with these methods, it's really common geographic information-based techniques to be able to explore the different relationships that we're interested in exploring. So there are a couple goals when you start thinking about exploratory spatial data analysis methods. One being you're interested in trying to describe and ultimately visualize spatial distributions. Another goal is to identify outlying relationships or outlying locations, spatial outliers. Another goal is to discover the different patterns that may exist in terms of, are you seeing clustering? Are you seeing hotspots? Are you seeing cold spots? And then ultimately trying to assess a number of different ways, including subjectively and objectively, whether or not spatial heterogeneity actually exists. And in terms of how you do this, there's software that exists. And so there's GIS-based software, things like ArcGIS that is produced and manufactured by Esri or Geoda. And then there's also open source software. I particularly utilize R, which is an open source software. And then lastly, web-based mapping platforms that you can utilize in things like Google Maps or even Adobe Illustrator that have specific graphic designing capabilities. So the first method I want to kind of point out may seem pretty simplistic, but choropleth maps are really at the cornerstone of exploratory spatial data analysis methods. Well, what are they? These are maps that are basically representative of different shades or colors that allow for geographical areas of interest to be able to then identify if there are patterns present. And this is often done at administrative boundary levels or even other ways that you're defining neighborhoods. And it allows for a subjective assessment of what would be geographic patterning. And in terms of what can be captured in these choropleth maps, a number of things can be captured: health outcomes, social outcomes. This can be done at the aggregate level. This can also be done at the point level. So choropleth maps are really powerful tools to be able to understand at a very basic level what potential geographic patterns might be present. Now, this question of, well, how do you create them? How are you really trying to think through with respect to, say, fundamental principles here? And I'd like to pull in geospatial data literacy. I think that with respect to your eyes being towards creating these choropleth maps, you really want to be in a position to be able to create and judge the reliability of the spatial data first that you have interest in mapping, and creating ingenuous maps, right? Creating maps that are not necessarily at the expense of being good or at the expense of, say, for instance, easy to read maps. And so this image that you have here on the left, it really is a nice way to capture the multiple domains when you start thinking about, well, what is geospatial data literacy? So it's a function of four things. It's a function of problem solving. It's a function of technologies. It's a function of GIS, geographic information science, as well as computational science. And so one thing to keep in mind, though, when we're talking about choropleth maps, we really have this cautionary tale that we have to keep in the back of our minds, that there's power in maps. And we have to lead with creating trustworthy thematic maps instead of, say, misleading thematic maps. Because once we step into this space of creating these misleading thematic maps, it could lead to misinterpretation and misinformation. The second method that I like to highlight are Moran's I statistics, or Moran's I tests. These are statistical measures and a way for us to estimate or assess the potential spatial autocorrelation that's present. And when we're talking about spatial autocorrelation here, it's really us trying to gauge the degree to which phenomena values themselves are correlated in space. And when we're talking about being correlated in space, we have to recognize that regions are not operating in an independent sense. Regions have neighboring regions, and there's oftentimes spillover with respect to the people that live in particular regions and how they move in and out of different regions, especially neighboring regions. So with Moran's I statistics, these are the objective complements, if you will, to choropleth maps, and it allows for us to ask and answer ultimately very specific questions. And I have two here listed, are the high or the larger values of the phenomena that you're interested in measuring or capturing in one region, are they actually surrounded by other high, similarly larger values in that same neighboring region? Or separately, is there an inverse relationship here? Are the higher large values of the phenomena you have interest in measuring in one region surrounded by other low or smaller values? These are important questions that you can answer when you utilize a method like Moran's I statistics or tests. And when we get to the crux of the actual functioning behind the Moran's I statistic, it really is a function of this square difference, if you will, between what you observe in a particular region, say region I, compared to what's expected in that same region. The difference now, though, is that there is a weighting that's being captured within this formula itself. The weights, the WIJs that are here, these are based on how we actually classify who is a neighbor. Which neighboring region are we talking about? So when you define a neighboring region, you can do this based on contiguity, you could do this based on distance. So there are some options here. And the distribution of this Moran's I statistic, it's often assumed to be normally distributed. And when you go to try and interpret it in terms of what this number actually means for the phenomena that you're interested in capturing, it has some similarities between simple correlations. So for instance, a -1 for the Moran's I statistic, it's really leading towards evidence of an inverse relationship, a negative spatial correlation. A +1 is indicative of positive spatial correlation, where 0 is indicative of no apparent spatial correlation whatsoever. This third map builds off of the choropleth maps as well as the Moran's I, and these are now what are called LISA maps. So local indicators of spatial analysis maps themselves, these are ways to basically identify localized regions in a map that have a strong positive or a strong negative pattern. And so the 4 different patterns that are quite possible when you think about these types of maps can show high patterning. This really is speaking to regions with high values that are then also surrounded by regions with also high values, or low regions, low valued regions surrounded by similarly likely low value regions, and then the inverse of these different scenarios. Again, just like with the other methods, there are different questions that can be answered when you're utilizing a method based off of LISA maps. And in particular, well, which locations or which regions are making a real meaningful or even significant contribution to the global heterogeneity or the global spatial patterning and what you might be observing within the data that you have. So I want to kind of dig in just a little bit to a few different empirical examples with respect to utilizing these exploratory spatial data analysis methods. And this first one that you have here, it shows the usage of choropleth maps. And in particular, it's of marijuana producers from my research team and I that we published back in 2018. And this was capturing what's going on in the state of Washington at the time, who were early adopters of privatizing marijuana production, processing, and also retailing. And this had implications on usage. And so the map here shows the geographic patterning at the census tract level in the state of Washington, but because Seattle, for instance, is so densely populated, and especially in comparison to other parts of the state, the panel on the left that you see it's zooming in on the census tracts that are in the Seattle region itself. And it's allowing us to basically get an understanding of this distribution of the number of licenses within a given census tract for the Seattle region itself. A second example, again, utilizing the choropleth maps, but now this is work that focuses on the overall health of the United States across United States counties. And again, this is research that my team and I led, and we focused on looking at county health rankings, which was funded by the Robert Wood Johnson Foundation, in that we utilized the 2017 release of their data, where they're really focused on measuring health outcomes overall, and how the health outcomes that were being mapped here are really based on two things: measures with respect to the length of life as well as quality of life. And the map shows pretty much a continuum, if you will, of colors between red, which is indicative of poor overall health, and then blue. These blue counties are more indicative of ideal cardiovascular health. And what you can note, though, is that there's some apparent clustering of red counties, say in the southeastern part of the United States. And remember, red is indicative of poor overall health. And then there's clustering as well of blue counties, if you will, say in the Northeast and Midwest parts of the country. Again, blue here is indicative of ideal overall health. Now, in addition to us trying to capture visually the geographic patterning of overall health across the counties, the Moran's eye statistic is also provided in the upper left-hand corner, and it was significant. And what's being tested here is that it helps us to understand that we really do, in terms of what we're interpreting in the map, we're more than likely to see this clustering, and that the results are showing that there's evidence of significant global spatial autocorrelation. And the clusters that we're seeing, whether it be in the Southeast or even in the Midwest part of the country, it's more than likely not to be statistically significantly clustered. But this, again, is more of a global assessment itself. Now, this last empirical example, before moving on to the inferential spatial data analysis methods that I'd like to highlight, shows again the usage of these choropleth maps of now the geographic patterning of COVID-19 related outcomes. These COVID-19 related outcomes were specific to testing and positivity, confirmed cases, mortality, and then also a social vulnerability index. And this was all for the city of Chicago, and it was based on zip code tabulation areas. And this here was a way for us to utilize LISA methods as well. And this work, again, was led by a team that I was a part of here at Drexel in efforts to really understand this distribution of neighborhood level COVID outcomes to then inform future COVID-related interventions and policies, especially in cities like Chicago. The entire top row of these maps are basically showing the geographic patterning of each of these COVID-related outcomes and the social vulnerability index itself. The bottom row contains the corresponding maps that basically highlight the high patterning, which are the darker ZICTA clusters, the zip code tabulation clusters. And these are what are called hotspots. And then the low patterning, which are the lighter colored ZICTA clusters. And these are what are referred to as cold spots. This type of corresponding map allows you to display the local testing, if you will, of clustering. So for the first COVID-19 outcome of testing, we didn't see a ton of geographic patterning in that first choropleth map. However, in the central eastern part of the city of Chicago, there was a cluster of ZICTAs that had a high amount of testing that was equally surrounded by other ZICTAs that also had a high amount of testing. But then you had a different story on the south side of Chicago. There was a small cluster of ZICTAs that didn't necessarily have a high amount of testing. It was surrounded by these ZICTAs that also had somewhat lower amounts of testing. And this was identified pretty early on as a cold spot during the pandemic itself. And this then led to efforts to make testing more equitable across the city of Chicago and started to translate into other cities as well. These maps in combination allowed for more granularity when it comes to assessing the presence of clusters when examining, say, the geographic patterning of any type of phenomena that is being presented. Here we focused on COVID, but this can be translated to a number of different settings. Now, what if we want to allow for some additional rigorous statistical frameworks? Inferential spatial data analysis methods allow for this. Regression-based approaches are a way for us to formally assess the geographic-based associations, and also if we're interested in predictions. So just like with exploratory spatial data analysis methods, there are goals here for inferential spatial data analysis methods. And a few that I've highlighted here is that we're ultimately interested in testing hypotheses of these geographic-based associations, and then identifying trends in the presence of spatial heterogeneity. Similar to the exploratory spatial data analysis approaches, there are the same types of software that are available to basically utilize these types of methods. The first inferential spatial data analysis method that I want to highlight are what are called spatial error models. Now, the statistical framework here is basically showing this relationship, if you will, between, yes, your independent measures of interest and your outcome that you're ultimately interested in trying to tie a story together in the presence of potential spatial autocorrelation. It's just that here, it's extending what typically is the ordinary least square setup, and that the spatial autocorrelation is now being confined into this spatial error term, if you will. But the spatial error term itself is broken up and decomposed, if you will, into a spatially unstructured, which is captured in this epsilon, in comparison to then the spatially structured or the spatially correlated errors. Now, when you look at the makeup of what this model shows, it really is allowing you to hypothesize, if you will, in terms of the errors that are present within us looking at this relationship between or the interested relationship that we have between our outcome and our predictors of interest, but in the presence of this potential spatial autocorrelation. So it's very similar interpretation-wise to ordinary least square setups, and we're able to understand this global relationship, if you will. The second model is the spatial lag model, and this is sometimes referred to as the spatial autoregressive model. The spatial autocorrelation, again, is confined in the error term, except now we have what are called spatially lagged outcome or dependent measures that are captured, that are a function here. And the nice thing about this type of model is that the outcome in each region is then being affected by the outcome in a neighboring region. And if you hypothesize this to be the case as well, this framework will allow you to do that. And while the global relationship is being captured, the spatial dependence, if you will, is simultaneously being allowed to be estimated. And it's being captured in what we call this rho parameter, and allows for us to make judgment calls, if you will, in terms of how strong the spatial dependence is or how weak the spatial dependence is. The spatial Durbin model extends the spatial lag model that we just talked about. And the extension here is that not only are we allowing for a spatial lag with respect to the outcomes in our neighboring regions, but we're also allowing for a lag in the independent measures themselves. So there are a number of different relationships that are allowed to be captured here. We have indirect comparisons that can be made across the different regions. We have direct comparisons that can be made that's within a particular region. And then we can look at this total relationship when we're talking about what's happening with respect to the spatial heterogeneity that's present. The nice thing about these spatial Durbin models, though, is that it allows for us to formally estimate the potential of spillover. And I alluded to this earlier in this webinar, in that if we're really interested in understanding the magnitude of the effect with respect to what's going on in our neighboring regions, and allowing for us to actually objectively measure what this is. This next inferential spatial data analysis method that I'd like to highlight are what's called geographically weighted regression models. Now, with geographically weighted regression models, it's an extension of traditional regression models, but what's happening now is that you're observing these associations at every location or every geographic region that you have interest in measuring. So the relationships between your independent and your dependent measures themselves, they are varying locally. So when we think about interpretations, though, it's a bit more complex than, say, an ordinary least square setup where you're looking at only measuring one global relationship, because here we're measuring at every single location. And that location could be represented as the latitude and longitude of a particular, whether it's at the census tract, whether it's at the county level, whether it's at the state level. And I think that the biggest point in terms of the difference between the geographically weighted regression approach and the other spatial error, spatial lag, as well as the spatial Durbin, the geographically weighted regression acknowledges that there's no one size that fits all. And that's more or less what's necessarily being captured in these other spatial regression approaches, because we're able to then measure things globally. This last method that I'd like to highlight, without getting into too many details, are Bayesian hierarchical regression models. These Bayesian hierarchical regression models allow for, instead of a deterministic or fixed framework with some of these other frequentist modeling frameworks that I just mentioned, it's more probabilistic. And the nice thing about the Bayesian hierarchical regression models as well is that they do allow for this multi-level hierarchically structured data. So if we think about individuals being nested within a particular neighborhood, and then neighborhoods that are being, say, nested, whether they're in counties or whether they're even in states, these types of models allow for you to acknowledge that hierarchical structure. And with these models, you can measure relationships that are geographically based, whether it be on a global level and or on a local level. So I want to show a few empirical examples to drive home the point with respect to these spatial regression models, and in particular, the frequentist spatial regression models, as well as the Bayesian spatial regression models. So this first empirical example, it goes back to the example that I presented before when I talked about exploratory spatial data analysis methods. And this was, again, research that was conducted so that we were interested in trying to really understand and assess this relationship in terms of the spatial heterogeneity and overall health across the United States, but it was honing in on the contributions of particular health factors and also county level demographics. So there were two aims in this study. One, we wanted to address how much spatial heterogeneity exists in health outcomes and factors themselves in counties across the United States. And then second, to what extent is the spatial heterogeneity itself and the health outcomes attributable to the spatial heterogeneity and the health factors, or even the spillover effects, i.e. what's going on in neighboring counties really impacting each other. So we leaned heavily on the conceptual framework with respect to the county health rankings, where health factors are impacting the health outcomes themselves. And the health outcomes are a function of two distinct things: length of life and quality of life. And then there were four distinct health factors that fell into particular domains: health behaviors, clinical care, social and economic factors, and also the physical environment. So not only were we interested in these health factors, but we were also interested in the county demographics, because we think that that also plays into this relationship between the health outcomes and the factors themselves. And I've listed out a few of what the county demographics were that we were interested in that make up pretty much domains with respect to race, ethnicity, age, sex, and also population levels within a given county, and the urban and rural status of a given county. Now, the first empirical example here is really trying to show the usage of these inferential spatial data analysis methods. And then specifically, we looked at utilizing the spatial error model, the spatial lag model, as well as the spatial Durbin model. All of the models themselves are really examining this impact of the county demographics and the health factors themselves on overall health. The difference, though, between the models is based on the assumptions that are being made about the spatial heterogeneity that's present in overall health relative to these demographics and factors. And while the spatial error model and the spatial lag models both show global estimated effects of demographics and factors, they both have separate spatial effects that make up their model. The spatial error in the error model, and then separately the spatial lag in the spatial lag model itself. The spatial Durbin model allows for, as I mentioned when I first introduced the Durbin model, both indirect and direct effects, which then allow for you to assess the possibility of spillover to then understand if the demographics or even the health factors in one county mimic the same relationship in neighboring counties themselves. And then this second empirical example really focuses on utilizing, yes, inferential spatial data analysis methods, but how to specifically capture the spatially varying racial inequities that exist in an outcome like, say, cardiovascular health. And in particular, the role of individual and neighborhood level factors across the US, utilizing an NIH-funded cohort found in REGARDS. And REGARDS stands for the Reasons for Geographic and Racial Differences in Stroke Study. REGARDS is a national cohort study, and it has over 30,000 Black and white participants residing in all contiguous states across the US, with a focus on following these participants over time to understand their cardiovascular health as they age. So this again was research that was led by myself and my research team, and we had a couple of study aims, right? We wanted to know what the impact of both individual and neighborhood level risk factors were on the spatially varying Black-white differences in cardiovascular health. We wanted to look at this globally as well as locally. And we also wanted to know if structural racism played any role whatsoever in us trying to explain what these differences are. At the individual level, we had information with respect to age, sex, income, education, as well as marital status for each of the REGARDS participants. So the typical confounders that we wanted to consider. And then at the neighborhood level, we define individuals within the REGARDS cohort based off of their neighborhood according to their census tract. And census tracts typically in a region can range from, say, 2,500 people to like 8,000 people per census tract. There were additional neighborhood level metrics that we cared about, things that we know had impacts on cardiovascular health. So social engagement venues, favorable food stores, physical activity resources, how walkable their neighborhood was, whether or not they resided within the stroke belt. And then also one way to capture the impact of potential structural racism was racialized economic segregation. And we utilized the index of concentration at the extremes to look at these extremes between low-income Black and high-income white residents within the REGARDS cohort. So what this is showing is that in this work, we utilize Bayesian hierarchical regression models to then capture this spatially varying Black-white differences in cardiovascular health. And it was very specific because it related to the individual level factors as well as the neighborhood level factors. And in particular, racialized economic segregation was the one measure at the neighborhood level that found to be extremely important in trying to understand, if you will, this relationship between cardiovascular health and these individual and neighborhood level factors. And then because we also had interest in state level variation for these Black-white differences, the Bayesian hierarchical regression models allowed for us to add in additional random effects at the state level. And so the corresponding map that we have here that was published in the paper shows state level variation when utilizing this type of framework, and allows for the individual and neighborhood level factors to be considered in predicting this geographically varying cardiovascular health differences between the Black and white REGARDS participants. And while the choropleth map itself is showing like a range of implications to the overall Black-white differences, when you really do hone in on looking at the scale, you see positive and negative values here. And what this is speaking to are the positive and negative changes to the Black-white differences that we found globally, but here now it's specific to each state. And this has implications. It has implications to what this global difference really means in this particular study, where Black participants, unfortunately, in this REGARDS cohort had poor cardiovascular health compared to their white REGARDS counterparts. Now, before closing out, I just wanted to make a couple of comments with respect to where we started and then basically where we're now at within this webinar. We started off with an acknowledgement of earlier foundational research that was led by a pivotal scholar, W.E.B. Du Bois. And he focused a ton of his life's work on capturing the impact of neighborhoods on, say, Black communities in the late 1800s. And then tied this, if you will, to the importance of neighborhoods to the current focus when we find ourselves looking towards Healthy People 2030. And that neighborhoods are a really meaningful way to shape people's health outcomes as well as their exposures. And then we took a little bit of a deep dive, not too much of a dive, into some common exploratory as well as inferential spatial data analysis methods that allow for both the subjectivity as well as the objectivity assessment when we're talking about the impact of the neighborhood environment on these different health outcomes and exposures. So what's next, right? We really do, I think, have to lean in on this translation mindset all throughout the utilization of these types of methods, whether it be exploratory or inferential or both, in efforts to really understand the geography of health across the United States. And I think as researchers, we really do have an obligation to lead with this translation mindset. So with that being said, I think that collaborations with other scholars, community leaders, residents, like health professionals, policymakers, they really do all need to play a critical role in helping ways to be able to translate the findings, if you will, when utilizing these types of methods, these exploratory and inferential spatial data analysis methods. And while I don't think necessarily that the blueprint for what this translation could look like is simple, as reporting out, say, p-values, it really sure is a function, I believe, of how to meaningfully and thoughtfully use these methods with the geospatial literacy that I alluded to earlier on in the webinar in mind. And so with that, I will pause and I will take questions that folks may have.
Thank you very much for that presentation, Dr. Tabb. Excellent, with lots of participation in the Q&A and lots of viewing in terms of the numbers of participants that we've had. And the questions are rolling in, so I'm going to get started and try to get through some of them. So first question, conceptually, why are there spatial spillover effects? Is it that we can't account for all the confounding factors that are likely to be similar in geographic units next to each other?
Yes, I think that's a great question. I think when we talk about spillover, we're really trying to acknowledge the fact that there are these boundaries that are created that are defining a particular neighborhood. And as try as we might, when we think about creating these boundaries, people are fluid, exposures are fluid. And I think that in order for us to really get a good understanding of what first defines a neighborhood, it'll be really hard for us to kind of nail down the exact underpinnings of what the spillover is measuring, but we can start. So like, for instance, when we think about, people having access to care, if you think about the neighborhood where individuals live, their access to care may not necessarily reside within their own particular neighborhood. It may be that it's in a neighborhood that is a stone's throw away, or it may be that they're, accessing resources closer to their employer, which may be in a completely different state. And so what we're trying to do when we're talking about this spillover, yes, we're trying to objectively assess and estimate what this spillover might be, but there has to be a way to also capture the qualitativeness, if you will, of what potential spillover could be, and the reason behind the spillover itself.
Thank you. This is a completely different kind of question. How should we approach the ethics and community power aspects of geospatial analysis when it comes to big data and machine learning, both around the importance of highlighting local factors and conversely fears of further targeting communities that may have been discriminated against?
Yes, so that's a powerful question. I think that we first have to make sure that when we're talking about data and we're talking about doing all of these fancy models and trying to, sometimes overcomplicate our lives. But at the end of the day, we also have to understand that behind the data are people and experiences. And if we are observing certain amounts of data that's supposed to be representative of certain individuals, we also have to acknowledge that it may not be a complete representation of those individuals or of those circumstances that we say that we're trying to estimate. And so I really do think that it's important when we think about utilizing these types of methods that we are very cognizant as to not create additional harm and acknowledge the limitations in the types of data that we have at our fingertips, and hopefully lead with a thoughtful approach in trying to do that.
Thank you. How can you or others working in this field make spatial analysis toolkits more accessible for community utilization? Is that, yeah, what are your thoughts there?
Yeah, I think that we as researchers, we tend to, be somewhat cyclical, if you will. Like we create programs, we create courses, we create different ways to be able to train people who are already within the education space. But I also think that it's a missed opportunity for us to partner and work with communities to be able to then allow for a two-way interaction with respect to helping to guide what those teachings or trainings are to look like. And so I think it's really important for us as researchers and us as educators, if you will, to make sure that we're leaning in on understanding what the needs are of the communities and making sure that we're meeting communities where there are, so that then when we are in this two-way exchange, if you will, of education, especially as it applies to utilizing some of these different types of methods, that they're accessible and that they are digestible. But enough so that it's not at the expense of, the rigor, if you will, with respect to the different methods that are being developed or applied, but keeping in mind that there needs to be this partnership between the communities that we're trying to work with.
Thank you. We have a comment that investigators who use spatial statistics need to be extra careful of cherry picking p-values. There might be a temptation to tweak spatial parameters until the p gets to be less than 0.05. Can you comment on approaches to remain rigorous when you're using these methods?
Yes, I think that question really lends itself to, the ethics behind what it is that we say that we're going to do, right? And so when we're creating these statistical analysis plans, if you will, the statistical analysis plans are things that should not be conducted or created in an ad hoc manner after the fact, right? We have to be mindful of creating these plans and being true to what these plans are, so the data can actually speak for itself and not for us as researchers to be able to then cherry pick. I know for certain methods, certain approaches, when you're trying to ward off the possibility of duplicating errors, if you will, because of the multiple testing that might be at play, especially with respect to like geographically weighted regression approaches, there are ways to be able to adjust so as to not overinflate the potential for error. But I also think that what that initial question was getting at was really the morals behind how we are all approaching this type of work in the first place. And I think we have a duty and an obligation to lead with integrity and being able to be true to the data. And if the p-values are not telling you what you hypothesize, then that's okay.
I completely agree with you, of course. In the clinical trials world, we have the opportunity to publish protocol papers or statistical analysis plan papers where we say, before we've looked at any data, here's what we're going to do with the data when the study's over. Here's the analysis methods that we're going to use. Is there a lot of what you described was more observational rather than trial data? I'm not sure if there's the same opportunity to publish plans before the data are available for analysis, or if it's really up to the individual investigator to be thoughtful. Any thoughts there?
Yeah. No, I know that the comments that I was making before, it was really on the responsibility was on the investigator or the investigative team for them to be very explicit and mindful to articulate that that's what is going to be utilized in this process. I'm not familiar or know of any of these processes similar to what you're describing with respect to, like, say, the clinical trial setup but it's definitely something that I know myself as a researcher that I lead with, so as to not fall into this, realm of potentially cherry picking, because that to me then starts to speak to the integrity of your findings.
Agreed. A different question. When you're fitting these spatial regression models, maybe you've got several of them and you're trying to decide which one to report. Do you have suggestions for model fitting options or comparing options to compare models to decide which one to present?
Yes. And so I think, especially when you're starting to talk about models like the spatial error, the spatial lag, the spatial Durbin, these are models that are somewhat nested in the sense that you could compare across, but the goal is not always necessarily to compare to find the best one, but utilizing things like fit statistics would allow for you to make judgment calls objectively with respect to the fit of the data with respect to those modeling assumptions. And so I tend to lead with, whenever you are approached with this type of data, you really do have to first figure out what types of questions you're trying to answer to then lead you to the most appropriate method for the context that you're in. And so I don't think that any of these exploratory or inferential spatial data analysis methods that I presented are necessarily, I did not present them in a way where they needed to be pitted against each other, if you will, but more or less so that you can have the necessary tools to then be able to make your decisions for the context that you have, right? In certain settings, exploratory spatial data analysis methods are where you're landing, because maybe this is a new phenomenon. Maybe there's not a conceptual framework that's at play that allows you to even get into this prediction space, if you will, because of the newness of this particular phenomena. And that doesn't mean that you won't eventually get into this space where you're allowing for more rigorous statistical frameworks, but exploratory spatial data analysis methods are oftentimes utilized at the first line of defense in any way, before you start getting to the more rigorous approaches. And so I think that it really does depend on the context and the setting that folks have when they're really trying to understand implications of neighborhoods and how it's impacting or not, health outcomes, whether that's at the individual level or if it's even at the aggregate, like neighborhood level itself.
What is your advice for people who are using these methods in terms of how to evaluate the assumptions that underlie the models that they're fitting? Are there tools for that? What is your advice?
Yeah, I think that with a lot of these models, especially when you think about the spatial error or the spatial lag, the spatial Durbin, many of these models, when you are in a position to, after fitting them, being able to test for remaining or residual spatial autocorrelation, this is a way for you to really understand if the assumptions that are inherent in the model choice that you landed on, if it really is appropriate for the data, right? Really appropriate for the data at hand. If there's a significant amount of spatial autocorrelation that is still remaining, even after you've utilized some of these spatial regression models, then you have to really decide on whether or not this model is the most appropriate, or if it really is a matter of, well, there are unmeasured confounders that are likely at play, some that are global and some that might be spatially varying. And so that then might require, a revisit to the conceptual framework that you had in place that was driving the setup for that particular choice, that particular model fit. But these are some of the things to consider.
Thank you. A question I often ask presenters who are presenting on methods that are not sort of in everyday use. What's been your experience in terms of NIH review panels responding to an application that is built around these kinds of methods? Are these methods well received by the study panels that NIH uses? Are they far-fetched? What's been your experience?
Yeah, I mean, I think this is a great question. I think that when trying to solicit external funding and utilizing, NIH as an example, I do think that speaking only in terms of spatial and spatiotemporal statistical methods, language, can tend to kind of lose the message, if you will. So for instance, if you're interested in really trying to develop methods or even utilize new methods, utilize existing methods that are in this geographic space and understanding neighborhoods, it's really, I think, on the researcher to help translate and kind of get out of necessarily this like spatial and spatiotemporal statistical language that might be very common within, say, statistics or biostatistics. But when you're trying to secure external funds, you have to really be able to make this connection of like what the broader implications are. Because at the end of the day, you're not necessarily trying to secure funds for the sake of securing funds. You're trying to secure funds to hopefully improve health outcomes. So you have to, as a researcher, as someone who's writing a proposal that's utilizing these types of exploratory and or inferential spatial data analysis methods, you really have to find a way to articulate and translate in a way that is meaningful and understandable at a pretty broad level.
So a question near and dear to my heart. We often use group or cluster randomized trials to evaluate health interventions. And those trials often use geographic entities as the units of assignment. We might randomize communities, or I've done studies where we randomize counties. I've never randomized states, but counties, yes. Can you use these spatial statistical methods to evaluate the impact of the intervention, or do we rely on the usually mixed models, general and generalized linear mixed models that many of us are familiar with?
Yeah. I think that it really depends. So for instance, the mixed models that you referred to, if you have interest in making population level statements at, say, whether it's the county level or at the state level, and you set up your clinical trial in that the catchment area, if you will, from these different counties or different states, if you care about that representation at those levels, then utilizing some of these are or can be helpful. It can be, because it allows for you to then take into account that if you are, let's just say, for instance, you set up a clinical trial and it's a clinical trial that's across the entire US, and your unit is at the state level, and you have interest in understanding what state level implications mean. Well, state level implications in neighboring states versus states that are further away, that seems like something that you might want to take into account. And it's something that came up too when we thought about, how to deal with the COVID pandemic, right? When we were thinking about understanding the spread and understanding, policy implications across different states, and how there were similarities between certain contiguously connected states, say, when you start thinking about different pockets of the country. So I think that it's something that can be utilized if you have interest in wanting to make statements about the importance of geography in that context. So whether that trial is incorporating things with respect to, how people are moving about in their state, and how people are moving about in their communities or their counties, and whether that's important for you to understand within that clinical trial setup.
One last short question. Do you have packages in R that you're particularly you use particularly often in your work?
Yeah, there's a number of them. And one in particular that I've been using more frequently, it's found in Nimble. It is a package that recently came on the scene a couple of years ago in trying to fit Bayesian hierarchical regression models, especially those that lend itself within this like geographic space. And so that's one in particular, but there are a number of different packages that can be utilized within R.
Dr. Tabb, I want to thank you very much for your presentation and your lively back and forth here with all the questions. We didn't get to nearly all of them. You had quite a large audience and quite a number of questions, but I need to honor the time and turn things over to Dr. Moyer.
Thank you, Dr. Murray, and thank you to everyone who participated in today's webinar. On the Mind the Gap website, prevention.nih.gov/mindthegap, you will find several resources for this talk, including the slides and a list of references. We will also be posting a recording of today's webinar on our website in a few weeks. Thank you and have a great rest of your day.